Welcome to the We Level Up Treatment Center video series. In today's video we will discuss marijuana withdrawal symptoms. Marijuana use may appear harmless, but evidence shows that beginning the habit at an early age can lead to potentially dangerous consequences. Young adults who start before 18 are up to 7 times more likely of developing marijuana dependency and facing marijuana withdrawal symptoms than those older adults who wait until they're further along in life. The risks associated with this drug could make it prudent for young people and their parents alike to think twice about its usage. Or better yet, avoid starting altogether. The use of marijuana in the U.S. has seen an alarming spike over 2020, with 14 million individuals aged 12 and up now partaking. Quitting marijuana can be difficult, and the cannabis withdrawal syndrome may make it even harder. But understanding what to expect during this period, from cravings to mood swings, can be helpful. Despite not causing serious harm, cannabis withdrawal can affect one's quitting ability. The alluring sensations experienced upon reintroducing marijuana are often too strong, or someone attempting to abstain and may lead them back down the path of relapse. Common weed withdrawal symptoms. While not as well understood by young people especially, withdrawal symptoms of weed are adverse effects when someone using marijuana regularly stops or reduces their use. While many believe marijuana is not addictive, research has shown that long-term use can lead to dependence and withdrawal symptoms. Symptoms of weed withdrawal can vary from person to person. Common weed withdrawal symptoms include irritability and anger leading to aggression, anxiety, feeling nervous with restlessness, depression, insomnia, vomiting, nausea, headaches, sweating, and stomach aches, decreased appetite or body weight, undergoing disturbing dreams, cravings for marijuana, shakes or tremors, experiencing 3 or more marijuana withdrawal symptoms within 1 week of decreased marijuana use indicates cannabis withdrawal syndrome. Weed withdrawal symptoms can be mild to severe and last several days or up to a few weeks. For long-term, heavy marijuana users quitting cold turkey, going through the withdrawal process can be a difficult but rewarding experience. Acute physical symptoms such as 1 to 2 days after ceasing usage, nausea and dizziness typically emerge. 2 to 6 days before these weed withdrawal symptoms begin to relent. 3 weeks post-weed quit date, weed withdrawal symptoms peak in severity. While most weed physical withdrawal symptoms will have subsided, mental issues associated with withdrawal may linger. 5 weeks after quitting weed, difficulties sleeping are particularly common. Many struggle with insomnia or strange dreams for an additional month or longer following abstinence from cannabis use. Weed withdrawal stomach issues. Weed withdrawal can cause various physical and psychological symptoms, including stomach issues. Some people may experience gastrointestinal symptoms such as nausea, vomiting, stomach pain, or cramping during marijuana withdrawal. These symptoms can be uncomfortable and unpleasant but typically do not pose a serious health risk. Anti-nausea medications can help, but speak to a healthcare provider first. Quitting marijuana can provide long-term health benefits for those with chronic digestive problems. One reason weed withdrawal can cause stomach issues is the effects of marijuana on the digestive system. Marijuana can affect the muscles that control the digestive tract, leading to slower digestion and decreased appetite. When a person stops using marijuana, the digestive system may experience a rebound effect, resulting in discomfort. In addition, marijuana withdrawal can cause changes in the body's regulation of hormones such as cortisol and melatonin, which can also contribute to gastrointestinal symptoms. Stress and anxiety, common during marijuana withdrawal, can also exacerbate digestive issues. Where you are experiencing stomach issues during marijuana withdrawal, there are some steps that you can take to alleviate symptoms, such as drinking plenty of fluids to stay hydrated, avoiding spicy or greasy foods, and eating small, frequent meals throughout the day. Over-the-counter antacids or antidiarrheal medications may also be helpful for some people. Where you are experiencing severe or persistent stomach issues during marijuana withdrawal, or have other concerning symptoms such as high fever, blood in stool, or severe pain. Seek medical attention to rule out any underlying medical conditions. During weed withdrawal, some people may experience heart-related symptoms. These symptoms include a fast heart rate, palpitations, and chest discomfort. The increased heart rate is a common symptom of marijuana withdrawal and can cause anxiety, further exacerbating the symptoms. While these symptoms may be uncomfortable, they are generally not life-threatening and should resolve within a few days to a few weeks. However, if someone experiences severe chest pain or other concerning symptoms, they should seek medical attention immediately. It is important to note that marijuana withdrawal symptoms can vary from person to person, and some individuals may not experience any heart-related symptoms during withdrawal. Marijuana withdrawal psychosis. Marijuana withdrawal can sometimes lead to psychotic symptoms, such as hallucinations, delusions, and paranoia. These symptoms may occur in people who have used marijuana heavily and frequently for a prolonged period of time. However, not everyone who experiences marijuana withdrawal will develop psychosis. The risk of psychosis may be higher for people with a history of mental illness, such as schizophrenia. It is important to seek medical attention if any psychotic symptoms occur during marijuana withdrawal, as they can be alarming and distressing. Treatment options may include medication and therapy to manage the symptoms and underlying mental health conditions. Can a baby have withdrawals from weed? Yes. A baby can have withdrawals from weed if the mother used marijuana during pregnancy. THC, the active ingredient in marijuana, can cross the placenta and affect the developing fetus. After birth, if the baby is no longer exposed to THC, they may experience withdrawal symptoms, such as tremors, irritability, and poor feeding. The severity and duration of withdrawal symptoms can vary depending on the frequency and amount of marijuana use during pregnancy. Pregnant women need to avoid using marijuana to minimize the risk of potential harm to the developing fetus and the risk of withdrawal symptoms in the newborn baby. If you suspect your baby may be experiencing withdrawal symptoms from weed, it is important to seek medical attention promptly. How to deal with weed withdrawal. Weed withdrawal can be a challenging and uncomfortable experience for those who have developed a dependency on the drug. Fortunately, several strategies in weed withdrawal help are available to help ease withdrawal symptoms and promote successful recovery. One way to manage weed withdrawal is by seeking professional help from a healthcare provider or addiction specialist. They can guide tapering off marijuana use and offer medication-assisted treatment to alleviate withdrawal symptoms. In addition, supplements for weed withdrawal may help alleviate weed withdrawal symptoms. For example, melatonin, valerian root, and magnesium supplements can help with sleep disturbances, anxiety, and muscle tension that often occur during withdrawal. It's important to note that the timeline for weed withdrawal and the severity of symptoms can vary from person to person. However, it's common for anxiety to peak within the first week of abstinence and gradually subside over time. Therefore, it's essential to have a support system during this process and engage in healthy coping mechanisms, such as exercise, meditation, or therapy. In conclusion, seeking professional help, incorporating natural supplements, and practicing healthy coping mechanisms can all be effective strategies for managing weed withdrawal symptoms. Individuals can successfully navigate withdrawal challenges and achieve long-term recovery with the right support and resources. Please call We Level Up immediately to learn how our detox and addiction treatment program will help you overcome your marijuana withdrawal symptoms. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.